Welcome to NCLEXMap, your number one choice for mastering the NCLEX exam. Today, I want to share a key strategy for conquering the NCLEX. Understanding how every single question directly reflects the current NCLEX test plan. Many students focus on memorization, but true success on this exam depends on grasping how the content is tested. The NCLEX is designed to assess whether you're ready to provide safe, effective, entry-level nursing care, not just recall facts. Every question is tied to the National Council of State Boards of Nursing, NCSBN, test plan, which outlines essential nursing knowledge and skills. The NCLEX test plan is structured around four major client needs categories. 1. Safe and effective care environment, management of care, safety and infection control. 2. Health promotion and maintenance. 3. Psychosocial integrity. 4. Physiological integrity, basic care and comfort, pharmacological and parenteral therapies, reduction of risk potential, physiological adaptation. Each NCLEX question assesses critical thinking, clinical judgment, and nursing knowledge within these categories. But how does this actually appear in NCLEX-style questions? Let's look at some real examples. A charge nurse is making assignments for the day. Which client should be assigned to the LPN? A client requiring IV push pain medication. B. A client with a chest tube who needs frequent assessment. C. A stable post-op client needing wound care. D. A client with new onset confusion and restlessness. This question assesses management of care, specifically delegation and scope of practice. 1. LPNs cannot administer IV push medications, pharmacological and parenteral therapies. 2. A client with a chest tube or sudden confusion requires an RN's assessment, physiological adaptation. 3. The best answer is C. A stable post-op client, which aligns with the NCLEX test plan's delegation guidelines. When studying, don't just memorize tasks. Understand the NCLEX's focus on safe, effective delegation. A nurse is providing care for a client with C. difficile. Which intervention is most appropriate? A. Place the client in a negative pressure room. B. Ensure staff members wear an N95 respirator. C. Use soap and water for hand hygiene. D. Encourage the client to wear a surgical mask. This question falls under safety and infection control in the test plan. 1. C. Difficile is contact precaution, not airborne, no need for an N95. 2. Alcohol-based hand sanitizers do not kill spores, you must use soap and water. 3. Correct answer. C. This follows CDC guidelines. NCLEX questions test not just what you know, but whether you can apply infection control principles to patient care. A nurse is administering digoxin to a client with heart failure. Which assessment finding requires immediate intervention? A. Blood pressure 118/70ths of a millimeter of mercury. B. Heart rate 50 bpm. C. Potassium level 4.0 MEq. LD. Client reports nausea. This is testing medication safety under the NCLEX category pharmacological and parenteral therapies. 1. Digoxin toxicity is linked to bradycardia, HR less than 60, and GI symptoms. 2. The correct answer is B. Heart rate 50 bpm, as digoxin slows the heart rate. NCLEX pharmacology questions focus on nursing interventions and safe medication administration, not just drug facts. A new mother tells the nurse, "I don't feel connected to my baby. I'm a terrible mother." What is the best response? A. This is common, and it will go away soon. B. Tell me more about what you're feeling. C. You should talk to your doctor about medication. D. Try to focus on bonding with your baby. This question aligns with psychosocial integrity, focusing on therapeutic communication. 1. Dismissing the concern, A, is incorrect. 2. Suggesting medication right away, C, ignores assessment. 3. Correct answer. B. Active listening and therapeutic communication are priority. NCLEX isn't about diagnosing, it's about how nurses respond to patient needs. Now that you've seen how NCLEX questions reflect the test plan, how can you study more effectively? 1. Use the NCLEX test plan as your guide. Identify weak areas and focus on how content is tested. Study in client needs categories instead of isolated topics. 2. Practice NCLEX style questions every day. Focus on rationale. Why is one answer right and others wrong? Connect questions back to the NCLEX test plan topics. 3. Think like a nurse, not a student. Always ask, what would a safe, entry-level RN do? Prioritize patient safety, delegation, and clinical judgment. Every NCLEX question you encounter is purposefully designed to reflect the current NCLEX test plan. Your success depends not just on knowing facts but on understanding how to apply nursing knowledge in real-world scenarios. So, when you study, don't just ask, what's the answer? Ask, how does this reflect the test plan? That mindset will transform the way you prepare and ultimately lead you to NCLEX success. Welcome to NCLEXMap, your #1 choice for mastering the exam. Rocket.